This is for men and women who has been told everything looks normal, but it does not feel normal at all. The energy is not what it was, not the kind of tired that sleep will fix, the kind that is just there, and the mood that shifts in a way feels unfamiliar. The weight is changing even though nothing else has. The sharpness, the drive, the confidence, they quietly diminish. For some people, this happens gradually. So gradually, they never realize it is happening until they do really severely. And they have wondered how long it has been this way. Your hormones, your estrogen, progesterone, testosterone, they do not just affect production of your drive. They govern your brain, your sleep, your metabolism, your bone density, your cardiovascular health, very importantly, your skin, your mood, your sense of self. When they begin to shift, which happens gradually over the years, the changes feel scattered and hard to name it, which is exactly why they get dismissed. Bioidentical hormone therapy uses hormones that are molecularly identical to what your body already makes. The goal is not to push the number on the lab result. The goal is to restore the levels where you actually feel well. Published research confirms that properly managed hormones that will improve your energy, better mood, regulate your sleep, help with body composition, improve your bone density, improve your cardiovascular health, cognitive function, and overall quality of your life for both men and women. At ARBOUR Longevity, I assess every patient through their complete picture, not just the lab value, your symptom, your history, your metabolism style, your cardiovascular health, and your goals, your life, because normal and optimal are not the same thing, and you deserve to know the difference. If any part of this sounds familiar to you, this is a worth conversation. Tap the link below to book your first consultation at ARBOUR Longevity in Ann Arbor. Your well-being is worth prioritizing.